All right, so welcome everyone. Thank you once again for joining us for our monthly What's Up Doc Donor Lecture Luncheon. I'm Jessica Lasan, Trust Associate, and I'm going to go ahead and introduce our presenter today, Dr. Jennifer Gittzus. She completed her undergraduate work in molecular biology at Yale, followed by medical school with the University of Connecticut and an internship, Infectious Disease Fellowship at Dartmouth-Hitchcock. She has been with Concord Hospital since 2007 and was recently named a Concord Hospital Medical Group Senior Fellow. Dr. Gittzus works full-time, 100% of which is dedicated to her clinical work, and is married with both a 9-year-old daughter and a 6-year-old son. Thank you.
All right, can everybody hear me okay if I speak like this? All right, if you can't hear me, interrupt me, and this is supposed to be is fun if you can, so feel free to ask me questions throughout, and just thank you so much for this opportunity. This is sort of a talk a little about infectious disease, but a little about kind of a unique way we do outpatient IV antibiotic therapy here, which I think is kind of unique to Concord Hospital. So sort of just some basic stuff. Who am I? Obviously, that's me. I've been here since 2007. I do full-time clinical work, which is, it's kind of nice to just really be patient-focused. And I'm with the Infectious Disease and International Travel Clinic. This is the Memorial Building, which is what it used to look like before there was like, big digging machines in front of it and stuff. But we're right here on campus, which is nice. And this is our team. As you can tell, we are big Patriots fans here. I'm very flattered that they made me Tom Brady, actually. But there's 4 of us as providers. There's 3 docs and 1 awesome nurse practitioner who just started with us about a year ago now. And we have a lot of support staff. We have some awesome nurses and medical assistants and patient care coordinators, practice manager, assistant practice manager. So we're really, we work really well as a team. It's been just a great practice to be part of. And so what exactly do you do as an infectious disease specialist? Which is funny that you don't really think of what we do until you need us. So what do? Well, we treat infections, but things like skin and soft tissue infections. We treat bone and joint infections. We treat blood infections. We do HIV and AIDS. That's still a big part of our practice. We treat hepatitis C, where there's been some really huge developments lately. We do tuberculosis. We do tropical medicine sometimes. We do travel counseling, which is kind of a little different, which is talking to people who are going to travel somewhere interesting about what vaccines they might need and how to stay safe. And a large part of what we do is antibiotic management, including this thing called OPAT. So what does OPAT stand for? OPAT means Outpatient Parenteral, meaning IV, Antimicrobial Therapy. So it's basically IV antibiotics or IV antifungals not in the hospital. So there's official demonstration. Official definition is that it's administration of IV antibiotics, at least 2 doses, at least 2 days apart, without being in the hospital. So basically getting IV therapy not under this roof. So there are guidelines. I'd like to point out this is page 1 out of 35, so there are very long, exhaustive guidelines about how to do this. But I wanted to talk a little bit about one unique way that we have doing it here. So think, well, how does it happen that you come to need IV antibiotic therapy but not in the hospital? Well, traditionally, you would be admitted to the hospital for something, whether pneumonia or a blood infection or something. And then what happens is you're better enough that you don't need to stay in the hospital, but you haven't finished your antibiotics yet. So in that case, we get involved and we help set it up to do it either at home or daily infusions here or something like that. The other way is, you can come see us in the office, which is you see your primary care doctor, maybe you have like a wound infection that's not getting better, they call us up and say, can you see this person? And yes, we can. The problem is that it has to be not emergent. Like, if you call us in the morning, we might be able to get you in that afternoon, maybe the next day, but if you need antibiotics an hour from now, we just don't have the ability to do that in an office setting, at least not yet. So then what happens about the emergency department? And so I always think of, we say in our office, infections are inconvenient for everybody. Nobody plans to have an infection, and nobody plans to be in the emergency department. So the challenge, and this came out about, it's about 2011, so only about 8 years ago, hard to think of, is that we thought, well, what if you're in the emergency department and you need IV antibiotics, but you don't otherwise need to come into the hospital? So again, think of the emergency department. The emergency department does wonderful things. They are really good at what they do, which is they're open 24/7. You can get labs within minutes. You can get X-rays. You can get CAT scans if you need them. You can get an IV into people. You can't give IV medicine if they don't have an IV. And you can give IV medicines, including IV antibiotics. But the problem is that it's not really a long-term destination. So again, about 10 years ago, you're the patient, you're in the emergency department, and if you're sick enough, it's easy, you come to the hospital. And if you're not that sick, you just need a splint on your twisted ankle or something, well, you go home. But what if you're in this kind of gray zone where you need IV antibiotics, but you don't otherwise need to stay in the hospital? So we did what we normally do. Oh, one second, look back up. So I want to talk a little about cellulitis, which is what I'm going to focus on a little, because this is a fair amount of what we do. Cellulitis is a skin and soft tissue infection, so I think of it as the soft, squishy stuff. Skin, the stuff that's right underlying the skin. It's really common. It's treated with antibiotics, either pills or IV, depending on how severe it is. And a quick word on, what's the difference between IV antibiotics and pill antibiotics? Well, we think about IV antibiotics are dosed in grams. Most medicines you take are in milligrams, like your blood pressure pill or anticoagulant or something. It's 10 milligrams or 2 milligrams, or 100 milligrams is like a big dose of a lot of medicines. For IV antibiotics, you give them in grams. Like a common one we use is cefazolin. That's 2 grams 3 times a day. That's 6 grams a day. It's hard to physically give somebody that much antibiotic in pill form. The pills would be this big. And then you think about it also goes directly into your veins, so you don't have to worry about chewing it up and digesting it and how much gets absorbed. The difference with pills is milligrams. And even when you think about most antibiotics are like the biggest pills you're ever going to get prescribed. If you get cephalexin or Keflex, they're like horse pills. They're like giant, ibuprofen liquid caps or something. They're usually much bigger than all the other medicines we have to take. And even then, those are dosed in milligrams. The equivalent of that IV medicine, where we dose it 2 grams 3 times a day, is something called cephalexin, and that's 500 milligrams. So even then, that's 1/4 the dose. And even then, how much of it is getting absorbed into your GI tract. So there's really a big difference in tissue levels. It's usually an order of magnitude. So you might get 10 times